For those of you that are a little bit newer to Kiko style acupuncture, we wanted to create this short video just to give you an idea about some of the most fundamental and basics of this particular style. So a lot of it is summarized for you on the first page of all the handouts that you receive when you study with Kiko or you study with me. But I just wanted to give you a little tiny bit more information so that it's a little bit easier for you to incorporate all this into your practice and try it out on the patients with a little bit more confidence. So the Kiko style is very much a hands-on practice. We don't spend a ton of time, gathering information through communicating with the patient, let's say ahead of the treatment. Most of the information and the diagnostic strategies and therefore the treatment strategies come as a result of palpation. So it's very much based on what you find through palpations. Therefore, it makes it a very objective way to proceed. It also allows you to have a structure that it doesn't matter what the patient comes in with, whether it's a very simple or a very complex chronic case, you always have a place to begin. And that's through the palpation of the abdomen, of the neck, and then with time, the back as well. So it gives you that confidence that no matter what, no matter how rare the condition that the patient may be bringing to your office, you have a place to start. So palpation is absolutely key. A lot of the conversation that takes place with the patient happens while you're actually palpating their abdomen or, checking their pulse, etc. So there's always that dynamic. We spend very little time just sitting there, just talking to the patient. It's a hands-on practice. It's also important to know that Kiko really spends time to find effective points, and that just doesn't just mean selecting a particular point combination. It really means identifying the point location and the exact place where that point will respond. And so this, in this particular style, this technique, there's a lot of checking and adjusting and making changes to the points. So before you place a needle in any treatment acupuncture point, you have to figure out exactly where it is on that patient. And we do that by relying again on the reflexes that you see the map of them on that page 1 of the handout. So it's always two hands working together. So with one hand, you're going to be palpating the reflexes, and when you find a positive reflex, which means that the patient presents pressure pain there, or they're ticklish on that side but not the other, they have discomfort or just feels weird to them, whatever they report that and especially when it's different from the other side, indicates a positive reflex. So when that reflex is positive, we would use that in order to find out where exactly is the exact location of a point that we're trying to treat with. So we're going to test the specific location. So if I'm, somewhere around large intestine 4, let's say I want to use this, it's easy to demonstrate here. So I know it's somewhere in this vicinity, but my needle is really tiny, so I want to be super specific and find the exact point. So I'm going to make adjustments to the actual location of where I'm pressing. I will also make adjustments to the angle that I'm using, right? And then I'm also going to observe how hard I'm pressing, and that's going to indicate the depth of the needle that I want to use. I know that the point is correct and it's I'm in the right spot at the right angle, at the right depth when the reflex changes. So as I'm holding the treatment point, using one finger, being very specific, I'm rechecking to see with my other hand to see what happened to the reflex. So that's just the overall dynamic that you see throughout the entire treatment so that we can find the most effective point. The reflexes change right away when you select the right point or point combination. So that is definitely our goal. So that's kind of the technical aspect of how we proceed. The second really important thing to understand about Kiko style acupuncture is that you're always trying to figure out the root or the constitution for the patient if possible. So what is a constitution? There are many different ways to understand it. One analogy is what is the weakest link in the chain, right? This analogy that if you have one link that's a little bit, not holding things together, the entire structure of the chain is affected. So if we can identify that particular link and strengthen that, the entire system becomes stronger. So our goal is definitely to try to identify that if possible. Identifying that will come, yes, from palpation, but also a little bit from the patient's history in terms of, have they had an injury or a surgery or a major illness that occurred in their life, sometime in their life, that ever since that moment, things haven't really been the same. Oftentimes there are these events in people's lives, whether they're, an actual physical event that happens, including illness. Sometimes it's something as they move or they change schools, or they go through acupuncture school, and the stress of that, it kind of changes how their body functions. We want to identify those if possible. So we're always keeping that in mind in selecting then which strategy to apply. In other words, you can use the timeline. So this happened to me at the earliest time, and ever since then, things have not been the same. I may concentrate on that, that injury or that surgery, and see if we can support it there. So again, that weak link idea. Another way to understand the constitution is think of it as your body's always running this to-do list, right? Constantly trying to process and trying to make sure that it completes different tasks. If it gets stuck on one of the tasks, then it doesn't matter how easy the other things on the list are. It just simply will not get to them. It will not be able to complete those tasks. So instead of trying to correct everything else that hasn't been completed, we want to pull back and identify the task where the body is stuck, where it's exerting too much energy, it's spending too much, it's preoccupied, spending too much time. And if we can identify that, then support it, the entire system again runs smoothly. So that's the idea, the constitution. Because of that, so in the combination of trying to identify the constitution and through palpation, our treatments become, again, the idea is to be very objective, that you're not swayed by why the patient, the patient may be coming in with symptom X, but that doesn't mean that we just go back to, look at the index of the book to get a collection of specific points that work for that symptom. We really, in Kiko style acupuncture, you want to do everything that's possible to move away from treating symptoms and move towards treating patterns. Patterns are a different collection of reflexes that the patient presents with. So that, again, and that will be identified through palpation. So you can have, to illustrate this, what it looks like, you can have 5 people come in with what seems like exactly the same identical back pain, right? They report pain in the same area, it's about the same quality, etc. However, when you palpate their abdomen, when you check the neck, you will have 5 different patterns that emerge. Therefore, every single one of those patients will have a very individualized treatment and a very different set of points. So we can't say that there are treatment points for back pain or treatment points for a headache. One of the, challenging things, but also exciting things, is that we have to move away from this idea of point prescriptions and think about what are the patterns. When you identify those patterns, when you clear reflexes, the symptoms will begin to change. Okay, so let's talk about palpation of the reflexes. How do we palpate? So you can follow along with the map that you have on page 1 of the handout. This is a little shorthand that you'll see on all the different handouts for Kiko's classes and my classes, just as like a reminder of the basics. This is what we do for every single patient when they come into clinic and every single time we see them. So in general, when you palpate, the idea is that wherever you press on the abdomen about 1 knuckle in, so to this depth on the patient, normal size patient, this should be comfortable and it should just feel like pressure for the person. A couple of tips as you're palpating, instead of using right at the tips of your fingers here is not super sensitive, and especially if you have longer nails, this will be uncomfortable. Instead, shift to palpating with just the pad. So if I put my fingers like this to get my hands together like this, this is the right way. This is probably the most sensitive part versus this is less sensitive. So try to shift this way. And then the palpation should be a smooth in and out to that again, that depth of one knuckle in and out. Try not to do the little like bouncy pokey things, and then also do not use a single finger when you're palpating reflexes. When you're identifying a treatment point, different story, right? Because we're trying to be super specific. So in fact, we are going to use one finger, but one hand is going to be looking for that treatment point, but the other one that's checking the reflex, always using kind of that, the dispersed pressure and one knuckle in. When you're palpating on the abdomen, you'll notice that we have reflexes on the left and right. So you always want to compare left and right whenever possible. There are some also down the center line. So we're just going to go, straight up and down. But whenever you see something on the left and right, make sure that you go in that order. And it's the easiest way for patients to tell what's going on. For many of our patients, they're not going to be able to they're not super sensitive or in tune with their body. So they may be like, I don't know what you're looking for on this palpation. What do you want me to tell you? So one of the simplest ways to get around that is to simply ask the patient, do you feel a difference when I palpate one side versus the other? Very straightforward. Everybody understands that because we understand that comparing versus just trying to tell you. The other suggestion is try not to put words in your patient's mouth or make suggestions. So don't say, is this painful? Because besides painful, a positive reflex could also be represented by the fact that that side is ticklish and the other one is not, or that side is tight and the other one's not. So again, if you're very new to palpation and you're new to this form of diagnosis with the patient, then just use that simple question of, do you feel a difference from side to side? When you look at the map of the reflexes on the abdomen, you see that they're not just random areas. The circles are a little bit bigger in the picture, the illustration, but the points, the regions of the reflex areas are very specific. So make sure that you're actually palpating within those regions. So if I'm on Oketsu, which is on the left side, stomach 26, 27, and kidney 15, I want to make sure that my palpation takes place within that region and I'm not too high up to stomach 25 or too low towards stomach 28. So be very careful. And initially, when you start to practice, get into that good habit of measuring and figure out exactly where you're supposed to be. Where's the channel? Where's the point? And that'll help you a lot. And again, I can't emphasize enough that if you're checking Oketsu, that your next step should be to check immune, which is stomach 26, 27 on the right side. So always do that back and forth. When you get to liver and spleen, you see that they're under the costal margins. So in this case, our palpation won't be perpendicular. Instead, you're going to go you're going underneath the ribs. That's the idea. So you can't always get there. Some patients have a lot of guarding and tension, but that's the intention. That's the direction. So about a 45-degree angle, you want to back away from the actual bone, from the ribs enough where you have some space to push underneath. And usually when we cover the costal margins, there are at least 3 presses. So I would go, let's say starting with the right side, 1, 2, 3, 1 being closest to the midline, 2 being in the middle, and 3 towards the sides of the body. So make sure that you're covering that entire region. When I do 1, 2, 3 on the right, my next step is to go 1, 2, 3 on the left, making sure that I mirror my hands and what I'm doing, so that what I did is exactly the same. Therefore, the patient can tell me if it feels different for them from one side to the other. So you also palpate at a 45-degree angle for the adrenal reflex, which is at kidney 16, right around the belly button. Imagine the adrenal reflexes, which are a very common presentation in practice. You'll hear that talked about a lot in Kiko-style acupuncture. Make sure that palpation, imagine there's like a little clock, and we're palpating at 4 o'clock and 8 o'clock. So 4 o'clock, 8 o'clock, since the belly button is pretty small, you want to reduce the number of fingers you're using. So maybe just use 2, palpate, and then palpate. This also brings up the point that don't palpate both at the same time. It's always one side, the other side. So that covers the left and right on the abdomen. That leaves us with the center line, the midline, which includes our heart insomnia reflex right underneath the sternum. This is the one that you use about half a knuckle half a knuckle in of pressure. So very gentle in this area. This is the heart, the emperor, so you want to be super respectful and think of it that way. Just gently press into this area. And then going down, you have the stomach reflex at CV12. So that's just a perpendicular palpation. Since you don't have left and right to compare to, usually what we do is just go down the midline, covering all those points, paying attention to the ones that are tight or feel the patient report as feeling painful or tight or ticklish, etc. Or weird. Patients have lots of different words. Sometimes if you're now getting a lot of feedback from the patient, just simply start counting as you move down. You're palpating down the body, just say 1, 2, 3. Did you feel a difference between those? And that could be a good way to get some information. So that's the abdomen for us. It's almost like getting the vitals when you go to your doctor. This is like the vitals for us. We always focus on the abdomen early on and rely on it for the majority of our point selection and our treatment strategy. So it's really essential that the palpation takes place. So even if you're totally new to this, you're just starting out, what you may want to do is start exploring and palpating just to start incorporating this into your practice. And even if you don't know how to release a particular reflex, it's a good idea to start feeling the difference in different body types and just the response from patients. You always, every time you palpate, your hands, your fingers learn. So it's a good idea to do it as soon as possible. So that's the abdomen. We also rely a lot on the palpation of the neck, and you see that in the handout as well. There are 5 main regions of the neck that are really important. 3 of them being along the SCM, which you'll see Kiko palpate all the time, almost every patient. So the palpation of the SCM, again, we're doing one side at a time, 1, 2, and 3. There are 3 regions, and then comparing that with the other side. So on this palpation, you want to use, again, the flat portion of your fingers, not right at the fingertips. And you want to make sure you're on the muscle. So if you think about the SCM muscle, it starts really close to, below the ear, and then it kind of becomes biggest in the middle of the neck, and then it splits into 2 at the bottom. So at the top, usually it's enough to just use 2 fingers and put pressure here, and that would be 1. When I get to the middle, I may, and some patients have to use 2 to 3 fingers, and I want to make sure I'm still on the body of the SCM. I haven't just fallen back behind it. So press 2, and then when I get to the bottom, I want to make sure I'm covering both heads of the SCM. So my fingers around here are resting on the collarbone like this, and then I just simply relax my fingers like so as they're resting, and then just slide. So if I'm here on the bottom, they're relaxed like this, and then I just go towards the center. So it looks a little bit different when you're doing it on yourself, but that's the general idea. So you're doing 1, 2, and 3. Now on the neck, this is not 1 knuckle in. This is not any sort of indicated pressure. This will vary quite a bit from patient to patient. So simply just see what feels right. It's hard to explain, but you'll know when you're with the patient. You can do 1 pass, and if it felt like you did it too light, just go back again. Always side on light first, and then you can go back with a little bit more pressure if you feel like their neck is a little bit more muscular. You kind of underestimated what it feels like. So, but make sure you start out light. So that's 1, 2, and 3 on the neck. So the top portion, number 1, is the top of the SCM. This represents ear, nose, throat. It can also represent C1 subluxation. The middle portion represents neurological, more specifically the autonomic nervous system. And then the bottom palpation is for thyroid. So those are the reflexes that we're focusing on when we do that palpation. Next, we have what's called the immune reflex. This is located at triple heater 16, which is a little bit behind the SCM. And then the area is not just triple heater 16 alone, but also includes a point which is called east wind, which is 1 soon below triple heater 16. So basically the immune reflex on the neck is a 1 soon area. So what you want to do here is, because it's behind the SCM, and the direction of palpation is up, not towards the neck, towards the spine, but instead up towards like the chin, or if the patient is laying down, towards the ceiling. It's almost like you're gonna hook your fingers a little bit and then press upwards. So I'm here. If I press straight in, that's wrong. But if I just relax my fingers into a tiny little small hook and then I press forward, that's the correct location. And then you can do a little tiny overlap, pressing one area and then shifting down just ever so slightly to make sure that you're covering the entire one-soon area. So that's the immune reflex. And then the final one on the neck, the fifth one that we use quite a bit, is called the neurovascular compression on the neck. And it's sort of the triangle and checking of the scalenes, the tightness of the scalenes, and looking for neurovascular compression. So for this one, again, you don't want to dig in here. This is just a relaxed hand like this, nice and soft fingers, and then pressing straight down. So, and I'm just palpating this whole region. This kind of pressure on somebody that has very tight scalenes may produce, either shooting pain to the head or some discomfort or tingling down the arms. People have all kinds of tightness through here. And because so many of us spend time, with this area tightened, it could really be affected. So that's the SCM. That's the neck region, the 5 major reflexes of the neck. So again, we incorporate those at different times. The book goes into great detail about when, but just to kind of give you a quick summary of how to do it, that's the neck. The other portion, before I talk about the back, which the back is sort of the continuation of the front treatment. So when you're starting out Kiko style acupuncture, oftentimes you're not really getting to the back in the first treatments anyway. So we'll skip that for a second. But one thing that is really, really important, and we do all the time, pretty much every single time we see a patient, is to check the fire points. So this is a very specific thing in Kiko style acupuncture that we have to rely on quite a bit. So what does it mean to check the fire? Well, first of all, fire points are the 5-element point, which is the fire point. So every channel has it. We really, for the purposes of practice and kind of to make it simpler, we really rely the most on the yin channel on the feet. So that's kidney, liver, and spleen. Almost every single patient, if not every single patient, every time you see them, you check those points for them. So the fire points are reflex points. And we also have a very specific palpation style that we apply when we're checking them. So what you want to do is when you're checking liver 2 or spleen 2, you want to apply 3 kilograms, so 6.6 pounds of pressure on in and out palpation. So again, how do I know what's 3 kilograms? Simply, go to get yourself a little scale, very simple analog scale, and practice. Press 3 kilograms down, practice with your thumb until you're landing on that 3 kilograms pretty quickly and right away. When you get comfortable, doing that, the next step will be, close your eyes, press. Open your eyes to see if you're at the 3 kilograms release. And within 5-10 minutes, you'll be able to get a sense of what 3 kilograms feels like. Most people are really surprised at how much pressure it is. So again, it's a good idea to practice this because having that muscle memory of what 3 kilograms feels like gives you this incredible tool to be able to identify and diagnose through this. I suggest a lot of times in intro classes, if you're brand new to Kiko style, just focusing on the fire points gives you really beautiful and quite effective treatment strategies and really helps patients. So it illustrates how powerful these treatments are. So for sure, try to practice this if you can. All right, so we're applying 3 kilograms of pressure. We're checking left compared to right, and if the patient says that this particular point has a lot of pain, right, so they say ow when you press, that's a positive fire point. We don't needle that. Again, this is just a reflex. Instead, in order to put out fire, we're going to use water and metal. So metal water combination is what we're going to use to get rid of the pressure pain on the fire point. So for each channel, so let's say I'm working with liver, if liver is positive, so I press on liver 2 and the patient on the right, let's say the patient says ow, then I'm going to needle liver 4 and liver 8 in the exact locations that release liver 2. So again, this dynamic of you press the reflex and then you hold liver 4. Most in Kiko style, you can think there's probably less than a handful of points that are against the channel. Most points are with the flow of the channel. So when in doubt, and especially metal water points with the flow of the channel is the correct starting place. This is what we think about. So as I pressed liver 2, the patient said ow. Next I go and I press where I think their liver 4 is. I'm holding liver 4 and I come back to liver 2, I press again. And I ask the patient, how is it now? If it's reduced, then I'm in the right spot. I want to recreate what I'm doing with my finger with a needle. Needle that point, it frees up my hand. I go to liver 8. Again, I press where I think liver 8 is, holding liver 8, recheck liver 2. How is it? Oh, clear. Okay, you're in the right spot. So this is the process. This is what we mean by positive fire point, that's a reflex, and then treatment of fire point, metal water point combination for that particular channel. So this idea, you'll read this in the book in Kiko's volume 1. Master Nagano talked about how fire points take priority. It means that if you find that the fire point on a particular channel has pressure pain, you have to select the metal water combination according to him. That's his experience. That's what works the best. Now, because you've selected those 2 points, that kind of closes the door on using any other points on that channel, on that side, below the knee or below the elbow. So it doesn't limit you, that's not the end for that entire channel. But if you think about the types of points that we have located, in the area below the elbow, below the knee, these are points these are like these star points. So you don't want to use too many of them. So think of this other rule that we have in Kiko style acupuncture is that you don't want to use more than 2 points per side, per channel at any given time. So ideally you're just aiming for 1, but if the fire point is painful, then you're using that combination of the metal water, therefore you get 2 points, in that region. So again, so the kind of to summarize the rules is fire points take priority, so always check them. If it's positive, the selection of the points on that channel, on that side, has been made for you. So it's this is a great treatment strategy to incorporate into your practice if you're brand new. Practice with your scale, practice the 3 kilograms, and then just, spend maybe like 10 minutes of your treatment time with the patient, just testing the kidney, liver, and spleen fire points, and then treating the ones that are affected. And that's it. And then proceed with whatever else, you want to do, TCM or, whatever other style of acupuncture you're applying, and just see how that shifts the patient's treatment. Very simple approach, and you really learn the power of these particular points. Of course, check out that book for more details of why and kind of what are we doing when we actually address and we treat the metal and water combination. It's really interesting. The only other thing that I have to mention here is that when you're checking, kidney 2 is the only fire point that stands out a bit because the technique for checking it is a little bit different than all the other ones. With all, liver 2, spleen 2, you're just pressing in and out and using that 3 kilograms of pressure. When you get to kidney 2, you don't want to just press in and out. It's always using kind of a sliding motion like this. It doesn't matter the direction. You can go, from the toes towards the leg or in the other direction. The direction isn't important. The most important thing is that you're doing that kind of swipe or slide when you're checking this point. And when I'm doing this slide, I am definitely applying 3 kilograms of pressure when doing this. So this is the only point that's different. All the other fire points you're checking by putting pressure in and out. So So that's a fire point. So again, you'll see this when you take any other section of the webinar or any of the, when you see Kiko, when you see my classes, we are constantly referring to if the fire point is painful, metal water. If it's not painful, you have some other options, but you constantly hear that language of positive fire point. So I wanted to kind of incorporate this into this video so you have a better understanding of what we're talking about. So the final thing that I want to mention is the back treatment. So Kiko always does a front and back treatment within the hour and 15 minutes that the patient is in her office. This is, the idea is that it's the most kind of balanced treatment, and we spend on the front of the body, we're really identifying the constitution, what are the key patterns for this patient. We're confirming that that our diagnosis is on the right track by selecting points to release those patterns, and if they work, it confirms our diagnosis. So by the time you get to the back, you're basically continuing what you identified and what you did on the front, continuing it on the back of for the patient. So it's a very different approach. On the front, we're always focusing on finding a reflex and using distal points to release that reflex. When you get to the back, where the continuation means, let's say liver was the main pattern on the front. So when I get to the back, I want to concentrate on palpating the liver reflexes on the back, but I'm also looking for slight tenderness or tightness that I actually needle into right in that reflection zone. So in the diagram that you have of the back, those areas are treatment areas, as well as areas that correspond to that are reflexes or correspond to those particular organs. So the back is really different. So again, if you are new to Kiko style acupuncture, it usually takes people, a year or sometimes longer before they can even have the time or really feel comfortable doing both front and back, and that's perfectly okay. It's just a goal that you can kind of work up to and work into as you progress with this particular style. So that's kind of the summary, a very, very quick and short summary, but I hope that it gives you a little bit of information, it fills in some of those gaps, and just helps you get started with Kiko style acupuncture.